Well, good morning, everyone. It's 10:15. I'm hoping and assuming that you can hear me. We also have Paul Chan online. I think everyone knows Paul, and Paul is my co-chair. So, Paul, I just messaged you separately, but do you think we should have questions after each presentation, or do you think we should leave them all to the end? What do you think is the best way?
I think maybe Q&A after each, then people can move or whatever.
Yeah, that's fine. That's fine. That was my instinct as well. So yes, that's what we will do, everyone. We will have our 3 presentations, and then if you've got any questions for the presenters, we can take those after the presentation. Although by all means, please pop some questions by text into the chat boxes. And then we maybe have a wrap up later on. I think we've got enough time to get through 3 papers and plenty of questions as well. So we have 3 papers on the subject of health, safety and well-being, but 3 quite different papers, it seems to me. We have a paper which is considering accident causation through machine learning, and looking at that in terms of machine learning, which is going to be very different in terms of a view of health and safety compared with our next 2 papers. We have a consideration of the COVID-19 regulations in the Irish construction industry, and then finishing off moving across to the US and looking at mental health essentially in the US construction industry. So 3 very relevant and interesting papers, and I'm looking forward to seeing these. So we start off with May Shayboun, Christian Koch, and Dimosthenis from Chalmers. I'm assuming you're from Chalmers, and their paper on a comparison of accident causation models and machine learning for applied analysis within accident reports. So if this system is working properly, what I will do is click at the top here and press play. Now remember, everyone, you have to tap to unmute. Okay, the mute is on by default. So if you see the presentation but no sound, then at the top left of your screen you should see a little tap to unmute. So we have our first presentation, just under 10 minutes, and as I say, please ask questions later. But by all means, pop some text questions into the chat. I'm pressing play now.
Hello, everyone, and welcome to this presentation. Today, I'm going to present a comparison of accident causation models, ACMs, and machine learning, ML, for applied analysis within accident reports. This is a joint effort done by myself, May, and my supervisors, Dimosthenis, Kifokeris from Chalmers University of Technology and Christian Koch from Aarhus University. The structure of the presentation goes as the following. We will start with an introduction and end with limitations and future research. And this is the exact structure of the paper as well. So recently there has been a noticeable increase in the number of publications that cover machine learning and applied in the construction industry, including safety and the analysis of accident reports. On the other hand, ACMs have guided analysis of learning from accidents for many years, and it's a very mature discipline. But machine learning and accident causation models have been equally criticized. Machine learning has been criticized for being less interpretable and require use case analysis, while ACMs have been criticized for their components and their path of explaining the way accident happens. Moreover, the role of theory of ACMs is not being adequately addressed in the current machine learning literature. So in this effort, we decided to investigate the role of ACMs as a theoretical framework for machine learning results analyzed, and to try to learn from machine learning regards the ACMs as well. The method of this study has been a disk study of the literature of applied machine learning in the analysis of construction accident reports and ACMs. It was done in a synthesized problematization method, and then the machine learning models were analyzed based on their purpose of analysis and the included feature and the ranking of important factors. The ACMs were chosen based on their types and their common application in the construction industry. 3 types of ACMs were used, one for each type category. The Swiss cheese model, the bow tie model, and the system theoretic axiom model and processes STAM. The Swiss cheese model is known for the levels of analysis, and that accidents happen when a combination of failures exist on all levels all at once. And then it is assumed that the activation barriers in each of these levels was not really well activated, which led to an accident. The STAMP model consists of 3 main components: constraints, control loops, and socio-technical levels of control. And here, accidents happen when failure happen at one of these components, such as constraints not being adequately enforced along the chain of along all the levels of the system. The bow tie model consists of components all around the top event, which caused the accident to happen, or the top event that the accident happened, and this is caused by the threats, the hazard, and cause consequences. And more importantly, there is a prevention barrier that needs to be activated for the top event not to happen or to reduce the impact of the top event. Machine learning analysis was classified in 2 different ways, and this is the classification of accident severity. And here mainly the machine learning algorithms were used to classify accident severity or predict the likelihood of fatality. This seems very promising in anticipating risks, but the problem is that the machine learning accuracy considerably drops in predicting fatal accidents. Here there was interesting features that we found, and most importantly, coupling accident type with accident severity and feature ranking, especially with using random forest. And compared to the random forest, artificial neural networks seem to be very promising in terms of high accuracies, but the problem is that ANNs are less explainable. The other type of applied machine learning is to classify accident causes and information retrieval. And here mostly machine learning was used in a way to classify accident reports, to basically label them into accident causes or types. And for information retrieval, one example is a prototype that extracted information and categorized them into hazard objects, hazard position, work process, and accident result. Here we can also see that feature ranking was done by random forest, which is an algorithm that have the possibility to show their feature rankings. And most importantly, here it was used to rank features for every accident type. And here we also have seen that deep learning had the advantage of showing a way to visualize causal variables in relation to each other. So in the analysis, we have analyzed the bow tie model, the Swiss cheese model, and we have seen that the bow tie model components are recognized in the machine learning components as well, such as the consequences most likely is related to something like the severity and the hazard position and object, and the accident types can be something like threats. But major difference can be found in the ranking of features, importance, and levels of analysis, while the bowtie model is more of threat, top event, consequence type of model. The Swiss cheese model has higher levels of causation compared to the machine learning illustrations of accident causes, because the machine learning models use features that were reported, but they are more related to the closer causes to the accident or the event than the distance causes, like the ones on top level management or decision making. The presented machine learning literature also attempts to couple the accident-related features with the severity of some type of direct relationship, but this relationship is still ambiguous, so it's a little bit hard to compare this to the Swiss cheese model paradigm. Both accident causation models here have defense barriers activation as a requirement for prevention, but this is not spotted in any of the machine learning literature which we have analyzed. But this is something that's probably not coming from the machine learning itself, but related to the way reporting has been done, and it has been acknowledged before that preventive recommendations tend to be skipped when reporting is being done. Our analysis also show that ACMs assume and promote severity as a stochastic element and impossible to be predicted, contrary to the reporting schemes and the machine learning models. Also, we have seen that system thinking is less used in the construction industry and probably even have higher levels of causation, such as the regulatory and governmental ones, and these are also harder to be reported. In conclusion, machine learning of accident reports can learn from components of ACMs, especially in identifying preventive measures. And valuable contribution is found in defining the relationships between hazards, accident types, and severity, but still focusing more on the modeling of risk is more important and probably more applicable when using machine learning. Future machine learning analysis is suggested to be more focused toward mapping of risks, therefore. ACMs can be improved also by ranking of features and visualization properties offered by data mining and the more explainable machine learning algorithms such as random forest. And this kind of visualization could probably show how the factors interact with each other, which could improve reporting.
So I've just unmuted my audio. Thank you very much, May, for that presentation. It's always handy when we've got pre-recorded, because we don't need to worry about keeping the time. We can all see how long you've got. So that was a great presentation, and you've touched upon a very growing area of research in many fields. The promise of what machine learning can do is very high, and many people in many fields are rushing to try and tap into this insight that machine learning can give, and not least, of course, in safety management. So I welcome that. As you possibly know, I've been working in this area a little bit as well. But it's not easy, and it's not easy because of the quantity of data that is needed in terms of the complexity, and to get a coverage of the safety scenarios, perhaps the safety field of individual locations and projects. So I have a couple of questions which I can ask myself, but I do open this up to our audience in this session. I'm just looking through the chat. There's no particular questions there, but has anyone got any questions that they have for May and her co-authors on this paper? Any questions in the chat? Any questions by audio? Anyone can speak if they wish to. No, we seem not to have. So, well, May, I've got a question for you. I mean, you've looked at this in terms of it's kind of a desk study in a way to link accident causation models with machine learning. Quite revealing in terms of your scope of looking at this theoretical base. But what is the next stage? Is it your intention to actually create some machine learning models and actually try out the theories that you're working on here? No, I think May. I think if you want to speak, I think you. There we go. There you are, May. So yes.
Here I am.
Yeah.
Yeah. So thank you for your comments and thank you for the question. Yeah. I mean, during this piece of the paper is actually a continuation of an effort that I have been working with, and in my journey, I have looked at how we can make context-conscious machine learning that actually takes into account the context that the machine learning will be applied within. And that's why I was looking at theory, because I do think that theories that are very mature in the discipline could be very good guidance into developing machine learning that we can understand and make sense of how we can use it, because the use case, as I mentioned in the paper, is very important. So we need to have the use case, and we do need to have a very good applicability, and therefore I thought that theory would be very good guidance for that. So yeah, so the continuation is to actually use these theories, probably a combination of models, that the ones that I have looked at, for example, the bow tie and the Swiss cheese model, probably use them in combination to guide my analysis of the data as well, and to build up on it as like a prototype. So this is what I am planning to do for the next step.
Good. Okay. And as you know, of course, from machine learning, a huge amount of data is needed in terms of training the networks and to test out the conclusions and insights that perhaps these models can create. Have you got that in mind? Have you got that lined up?
Yeah, of course. I mean, the data that I'm working with is about few thousands, less than 5,000 accident reports, for example. So that's not so bad, but also this is also not so many, I think, for safety, because there are some cases that are quite unique, and this was also found in some of the literature, that some cases were very unique, that they really couldn't predict or classify them because they don't happen so often, and that's a problem with severity as well, because the classification algorithms are not very are not great in classifying classes that are less presented in the data. And for us as like construction, the most important cases are the fatal ones, and these are the ones that people focus on the most, because they are the most like damaging and the most dramatic. And these are not so well. There aren't so many of them in the data. So there is a need to find a way around that, to actually learn from also all kinds of accidents, to reach some point that we can understand more about why accident happens, instead of trying to predict if it will be a fatal one or like a less severe one. And that's what I tried to say also in the paper, that that modeling of risks is probably the best way to go if we want to try to use machine learning in accident analysis, because probably we would learn more.
Yes, of course. And you touch there's a kind of an irony there, isn't there? That in order to create these predictive models to try and anticipate what future events might be, the best way is to have as many accidents as possible, which of course is kind of contradictory to what we're trying to do. But we're trying to leverage this data and knowledge that we've got in order to learn in the future. Now, just another quick question from me, because this touches upon a sort of investigation area I'm involved in, and what is the nature of these accident reports that you have? Because of course, machine learning, when you present such models with numerical data, that's of course how they can cope. That machine learning is a numbers thing. What about these accident reports, though? Presumably they're not just numbers and maybe textual and descriptive, and how can that be dealt with?
Yeah. Well, as you say, they're mostly descriptive, mostly textual data, and the thing is, they were not actually made for machine learning. So they were made to report accidents. They were made for another purpose. So that's also a challenge, to actually try to use this kind of data that was not actually done in the beginning for machine learning or collected for machine learning, but it's collected to describe what happened. So they are very descriptive, and that's a challenge, because I also found that less data could be used as an input, because what is being more described in the accident is the output, what actually happened after the accident has occurred. And that does not tell us much about that does not tell us a lot of information. But how to handle this, I think that there are more and more efforts that are handling textual data, and the machine learning is, I would say, my estimation is pretty humble, but I would say that there are really impressive algorithms and really impressive efforts in particularly analyzing construction-related data that can deal with text and extract features and make sense out of it. But that's why I also thought that accident causation models could help us contextualize and conceptualize also the features that the machine learning algorithms would extract, and let us know more, and to put it more into perspective that we can understand and use in a very, in a more useful way or practical way, I'd say. Yeah. So that's why I thought accident causation models could be good, because they would probably help us put features into context.
Yes, there's a lot to do, isn't there? And this is the challenge of textual data. I mean, one of the areas which we've been trying to delve into, and I know there are others in Manchester in particular, looking at using natural language processing. This is a well-established tool in other fields. I mean, Google are masters at this, in taking the textual data that we enter into our search terms and understanding what we're trying to say and what we're trying to mean. So, we'll move on next soon. But Paul has just put his hand up. Paul, have you got a question there?
Yeah, maybe a very quick comment on, just to rejoin with what May was saying. You mentioned about fatalities, but I think the work that Manchester did actually also pointed out the one biggest thing that had a huge impact was trips and falls. The causes of trips and falls may be, quite varied. On natural language processing, I think there's also one thing. Construction workers are maybe not necessarily too fond of documenting stuff. And even if they documented stuff, sometimes it's also rather chaotic, maybe. And I was just wondering whether you think that actually there could be also scope to do some sort of international comparison. Because, of course, we are thinking, in English, speaking in English, but I just wondered whether in Swedish there's any similarities or difference or, So I wonder what you thought about that.
If I understand your question, do you mean expressions of events in different languages?
In different languages, and also maybe construction workers have their own language that needs to be decoded.
Yeah. Oh, yeah, I do think that they do have construction workers, and the reports that I am looking at, I see some kinds of acronyms and abbreviations, and they are, I think, very specific to the language. And that's something that is really challenging for the natural language processing, because I think most natural language processing that are generic ones, like the algorithms, they don't have this kind of analysis for this kind of abbreviation, and that's why there is a very good need to be conscious about what the machine learning analyst is analyzing. And that is a challenge. But at the same time, there were some efforts that use the data, for example, to train part of the data that they will not use later on the analysis. They use this data as a dictionary to train an algorithm to aid with the NLP, and use this algorithm to extract the features. And there they use some kind of similar data to build an NLP that could also extract features. So basically they are trying to use this same kind of terminology that is available there. And I think that's really important, because right now in my work, I am struggling to find good algorithms, good natural language processing algorithms that are good with Swedish language, because there are many with English, but there aren't so many in Swedish. And I am trying to find whatever I can find here in Sweden. And this is very important, really. Like there are really good efforts into trying into formulating natural language processing algorithms that are based on domain-specific language. So I think that's very interesting, and I think that could be a very good effort in the construction industry for people to do that and make libraries that other people can use. So I think that's a very important issue.
Yeah, there's huge challenges, isn't there? I mean, obviously, trying to translate across different languages, but I've done some research in the past, and we've struggled with English. Frankly, English is in itself, it's not a standard language, and I've tried to deal with Scottish workers with their own choice words that they use to describe certain things, when they're supposed to be English, but actually, it's a very different thing. Anyway, we could chat about this for ages, and I wish we did have that opportunity. I find this topic very interesting, but we do have other papers. We must make sure we give attention to them. So many thanks to you, May, for your presentation. There may be some other comments coming up later, but for now, what we'll move on to our second paper, and if I recall from the chat here, it is Jim Bradley, who is presumably has pre-recorded the presentation on compliance with COVID-19 regulations in micro enterprises and SMEs in the Irish construction sector. So I'm going to press play now. Don't forget you need to tap to unmute, and we've got just almost exactly 10 minutes of presentation here. Okay.
This is a short presentation on a project that investigated compliance with COVID-19 regulations in microenterprises and SMEs in the Irish construction sector. This work was done in 2020 and 2021 by Stephen Barry, William Cronin, John Spillane and myself, Jim Bradley, and we're based at the Irish Construction Management Research Centre in the University of Limerick. The construction sector in Ireland is significant. For instance, in 2019, it was estimated that it contributed 27 billion to the economy. In 2020, this decreased by 35% down to 17.9 billion, primarily due to the impact of COVID-19. And this impacted on projects from a domestic, education, healthcare, industrial and infrastructural sectors. So it affected the full industry. And as we know, construction is very much a project-based industry. It's unique in terms of the mobility of the workforce, equipment and so on, the work practices that we follow, the worker type who are engaged in the industry, and also in terms of the uniqueness of every individual workplace within the industry. When COVID-19 hit, in March 2020, the Irish government announced the first lockdown and effectively closed all non-essential businesses, including construction, with the effect that in May 2020, 52,118 construction workers were receiving what was called the Pandemic Unemployment Payment, the PUP, because effectively they were out of work. This left a high level of fear and uncertainty across the sector because people kept harking back to the last recession in 2008 and 2009, where effectively construction fell off a cliff, and this was another cliff. What we were trying to do was have a look at what happened, what responses were there to the pandemic, and effectively to get people back to work, two organisations, the Construction Industry Federation and the Health and Safety Authority, developed a set of guidelines to facilitate the safe return to work in construction. And our research investigated how much compliance was there with these guidelines, and were there any specific factors that maybe influenced compliance. The guidelines that the CAF and the HSA came up with actually covered four main elements. First one, sanitisation and PPE. The second one being social distancing. They also looked at work practices, and to help they provided training packs and information packs that had sufficient information that allowed people to train their people, run toolbox talks, etc. So our methodology was to set up a pilot study in the time period from November to December 2020, working with companies that were either micro-enterprises, typically 1 to 3 people, or SMEs, 1 to 10 to 15 people. The companies also had to be in operation for at least a year prior to the onset of the pandemic, so we had something to compare it to. Overall, we managed to get 30 participants across 27 companies, ranging from the owners of those companies and directors right through to the operators who were on the coalface, so to speak. And our interviews were centered around a 57-question questionnaire with 5 themes: the tools to assist, thoughts on the guidelines, how people were compliant, the employee behaviour that we saw, and working within confined spaces. The findings that we got with regard to each of these themes are now to be discussed. And the first one is 100% of people said, yeah, we use spot checks for compliance, but 80% said it was very infrequent. In fact, sometimes it was done maybe once a month. Toolbox talks, again, a great tool for giving out information. 47% said they did it weekly, 57% said monthly, and this might be indicating that it was purely a tick box exercise that was done to prove they were doing it as opposed to add any significant value. 30% reported that their companies were using new communication methods such as WhatsApp, and 100% of them said they had in place signage and physical barriers to help with compliance. With regard to the guidelines themselves, 90% said, yeah, these are sufficient to prevent spread, but only 3.3% said that they were suitable for construction sites, okay, with the barriers to compliance being especially lack of supervisory staff. People couldn't go around and check where the rules being adhered to, and secondly, lots of old habits had to be broken, and this was particularly difficult. Also, there were issues such as worker isolation, manual handling, the use of unsuitable PPE leading to communication issues. These were all things that people who responded to our questionnaires and the interviews were saying. With regard to compliance, 100% said, yeah, the guidelines are understandable. But if you take an example, 96% said they did not always follow the PPE guidelines. With regard to hand washing, 97% said very, very difficult to do this. And 43% said by trying to stay compliant, it added significantly to their workload, with the result that in 89% of the companies, at least one extra member of staff had to be employed, and in the 11% remaining, more than 2 to 3 staff were employed as well. So that was a significant impact on these small companies. Working in confined spaces in particular gave us a few hairy moments, let's say. First of all, 40% said this impacts on our ability to work, and that it was everybody's opinion that it was really hard to break the habit of having multiple people working in a particular space. On the other hand, 67% said it didn't impact on scheduling, and 97% indicated that overtime was not required compared to pre-COVID. This might be an indicator that people were actually contravening the guidelines and continuing to work in groups in confined spaces, because otherwise you might well expect that the schedule would be impacted and also that overtime might be required. 93% said COVID-19's guidelines should be in place, so they're in favour. 97% reported that wearing the PPE was either unsuitable because it fogged up, or uncomfortable in that they couldn't hear, they couldn't see, or they couldn't communicate. With regard to the COVID-19 safe working guidelines in terms of working in confined spaces, these tended to impact on what we call traditional health and safety guidelines, especially covering things like manual handling and working alone. And again, the behavioural thing about old habits dying hard, and sometimes I forget, were used to sort of balance out the fact that there was a negative impact on compliance with the guidelines. So what are the implications? Number one, effective tools like toolbox talks and also new communication methods typically were underutilised, basically because of a lack of knowledge of their existence or their effectiveness, and also the fact that there was a limitation on the resources available. Secondly, looking at from the workforce, understanding the guidelines does not equate to compliance. So just because they knew about it didn't mean that they did it. Micros and SMEs don't have the staff to implement or supervise COVID-19 compliance on site, and in a lot of cases it was the health and safety staff who got lumped with looking after this as well. There was a general consensus that the guidelines are not suitable in real world situations, and this leads to lack of compliance. For instance, there was no safe systems of work planning that mentioned COVID-19 issues with regard to following guidelines. So it's often overlooked whenever people are talking about getting a safe system in place. The last thing then will be that there's contradictions between what we call traditional health and safety guidelines and COVID-19 guidelines. And typically people will come down in favour of the traditional health and safety guidelines with regard to things like manual handling and working on their own. So to conclude, we need to adopt this reasonably practicable approach. We also need to look at involving people in the development of guidelines. We need to look at giving extra staff to shoulder the workload, maybe developing SSWPs that would take COVID-19 into account, and also work towards avoidance of contradiction of traditional health and safety advice, because that's actually going to work against us. Thanks for listening, and if you have any questions, I'd be delighted to answer. Thank you.
Thank you very much, Jim. That was obviously very topical for all of us, and well done really on this piece of research. I mean, on the face of it, it might seem quite straightforward to do some kind of observational research in terms of COVID-19. You know, it's there in front of us, and why not take an investigation? But actually, you've taken on quite a challenging thing there. I mean, compliance in the first place is not an easy topic to deal with. in terms of questioning what compliance is in the first place, and why it's necessary, and what we do with that knowledge when we've got it. And of course, you've also been dealing with, obviously, a very drastically changing and dynamic situation, for many months. I'm sure the situation when you finished your research was very different than what it was at the start. So not an easy piece of work to do, and I think you've managed to present something very coherently and of interest to all of us. So I again have got one or two questions myself, but I will open up to others. I'm just having a look here. So just see, there's one or two questions. So Christian's saying, did you have possibility of comparing the compliance of the COVID regulations guidelines with other regulations such as health and safety? We've also got Fidelis saying, I think compliance with COVID regulations is within the wider health, safety and wellbeing area, which is true. So I don't know whether Christian or Fidelis want to expand upon those questions, or anyone else. Maybe you want to comment on those. So Christian says no. Fair enough. But Jim, do you or your co-authors, do you want to expand perhaps on one or two of those points? Essentially, really, in terms of, and this was related to one of the questions I had, generalising this work to the broader public health situation in the construction industry.
Oh, Jim can't get his audio to work.
Jim can't get his audio. John, I think, has just come on. John, do you want to say something?
Yeah, Simon, can you hear me?
Yeah, we can hear you fine, John.
Yeah, great. Okay. Okay, Jim's having issues there with the audio side. Yeah, look, to be honest with you, we tried to keep this as narrow as we could because it was obviously a preliminary study, and with COVID and the impacts of it, the access to individuals, like, asking some site operatives, can we have a Teams call? Obviously may not be as easy as one would think. So the big issue we had was getting to the people on site, because number one, as Jim alluded to, the sites were closed. And also then there were issues in relation to companies weren't exactly keen to have their procedures or whatever maybe exposed for the lack of compliance, etc., etc. So we tried to keep the study as narrow as we could, or to keep it as focused as we could, given the parameters with COVID and obviously trying to get access to individuals. But like some of the points there that Jim made, even from my own experience, like the one there that really resonated with me was the lack of hand washing. Like pre-COVID, there was a significant issue in relation to hygiene on site. Post-COVID, there is still a significant issue, but it's even worse. To some extent, I've seen on some of the projects, the extent of hand washing is a drum of water in a corner of a site. It's wholly inadequate, and half the time that drum is empty. So some of the pertinent issues we were trying to get were the ones that were really relevant to COVID and their compliance, and trying to get people to open up in relation to that regard. So we didn't really get a chance, nor were we looking at really taking it much more depth than that. But obviously, again, there is opportunity maybe for further research in that area.
Yeah, thanks, John. I mean, actually, just separately, Christian says he's not quite sure how to get his audio to work. I have to admit, I think I have to.
You can go on the little icon and upgrade them to a presenter.
As a presenter, yeah. But I think generally this is this issue about, and I'm going to ask my question here. John, please stay on, because maybe you can comment on this.
I just can't get my video to work, but look, you know what I look like.
My question is not intended to be a difficult one, and it might seem a cheeky question, but I'll go out and say it. What do you hope to now do with this research? And I mean that in a most positive way, because obviously we hope that this pandemic will, be over soon, and we hope that there won't be more pandemics like this in the future. So what have you
Yeah.
learned from this that you think can now be taken forward and used, in the Irish and more construction sectors worldwide?
Yeah, I tell you, an awful lot of this was more, look, and you really alluded to it at the very start where you're saying, look, a lot of this might seem very obvious. But like everything, sometimes the obvious is overlooked. So we're not, and I wouldn't be keen really to take it much further, because again, I'm hoping as we enter 2022 that, COVID and lockdowns, etc., will be somewhat a thing of the past. But yes, we will have still, some of the good practices brought in, like social distancing, but particularly the hygiene, again, the hand washing, etc. Pre-COVID, you would hope will remain. So the whole idea that, yes, some of the very few positives of COVID is we've all got better hand hygiene, etc., and you would hope that some of these practices would follow through post-COVID on sites. But from what we've seen, that's probably not the case, because in the first instance, they're not being done. But are we looking at taking it any further? To be honest with you, Simon, we're not really, because it's an ever-changing landscape. And if we were to look at to develop this into a larger study, by the time we get on the ground on this, etc., chances are that opportunity might have passed us, But I think it is a big opportunity.
Yeah.
Can you hear me now?
Can Jim? Yeah.
Oh, okay. It's the first day back on campus, so things are a bit crazy, and IT.
You have an office still.
It's just not good. Yeah, it's my first day back since 2020, so it's a bit crazy. But I'd agree with what John said, and just to bring up Simon's point there, I think when they look at guidelines, they were trying to get guidelines for the public health. They weren't, I suppose, really focused in terms of how will this affect specific industries. Probably fine for an office, fine for retail. But if we look at construction as being a very dynamic environment and a particular type of person working within it, where compliance is an issue anyway. And just to bring, I think Paul's point out about the chaotic documentation that he's had there with me, with regard to things like toolbox talks, when you ask people about their sort of implementation of this, it looked like they were just doing it purely as a tick box. So yeah. It's handy to say, yeah, we've done it, as opposed to go to different. This is a short presentation on a project that investigated compliance with Koch. So, it was definitely an issue that we saw there. Plus, I suppose when we look at compliance anyway, with regard to the types of operators we have in construction, a lot of them have the let's just do it type of mentality. So, if you have to go and get specialized PPE, or try and do something that'll take twice as long on your own, you won't do it. You'll go off and you get somebody to help you, or chance it without the PPE.
Yeah.
Because you're working with your friends,
Yeah, Simon, as you said, like in some instances, I don't want to be disingenuous, but there's a language in itself in it. So to suddenly turn around and tell guys you have to wear full face masks while they're sweeping out a room. Never mind in the UK, but in Ireland, the costs of materials here and labour has rocketed. So, and then suddenly now we're buying masks for 5-10 euros each, etc., and particularly this study focusing on SMEs, and they're saying, look, it's just not in the budget.
Yeah, they just don't have the resource. But also, I think, if you look at our culture, I had a Swedish friend who was here working for a while, and he went back to Sweden, and he said one of the things he noticed in Ireland was that road signs are just suggestions. And I think, when we look at compliance across the board, there's that kind of mentality. Sure, we'll be grand. And, we'll do what we need to do to be seen to do it, but we might not necessarily do it all the time.
Yeah. That's an interesting point there, Jim, isn't it? And it's, the touching upon different attitudes and cultures, and nationalities and how they respond. We'll need to move on because we've got one more presentation. But I like this piece of research, and it's a difficult one to say. Well, what's the point of this? What you're going to do with it? And it's naughty of me to ask that question, but that is the typical question. We're so used to having research say, well, this has got to have utility in the future.
Yeah.
And sometimes you don't necessarily need to do that, and I suspect actually that the insights that you've gained here will be valuable generally.
If there is something that, if we do happen to hit another pandemic, maybe some of the suggestions say, We need to listen before we generate guidelines.
Yes.
We need to resource before we expect them to be implemented.
Yeah, exactly. And not necessarily even in a pandemic situation,
no.
But in terms of compliance with health and safety.
Yes.
And how that might vary depending on the individual's attitudes to that.
Exactly.
You know, it's a very important area of research. So well done, guys. I'm sorry to have to sort of curtail this discussion because it is a useful one, but an interesting. But we must pay attention to our third presenter. And thank you, John. Thank you, Jim, for your presentation.
Thanks. Sorry about the audio problems earlier.
No, you're fine in the end.
Find it eventually. Thanks.
So. Moving on to, and this was touched upon, of course, in our intro plenary session in terms of mental health, a massive topic, of course, in all industries and construction in particular. And we're going to get an insight from the US, and I think we have Lauren Redden, who is the speaker, to tell us about mental health and suicide prevention programs in the US construction industry. So same as usual, we'll take Lauren's presentation and then hopefully open for questions as well. So don't forget, tap to unmute.
My name is Lauren Redden, and I am with Auburn University. I am the presenter of this paper, but there are multiple authors. And I have the pleasure of speaking with you about the research that we conducted about mental health and suicide prevention programs in the US construction industry. And thanks to ARCOM for putting this conference together. We are very thankful for the opportunity to be here today. Multiple authors of this paper, and this study is actually the result of a graduate student's work, Robert Schiffer, and I have the pleasure of presenting it to you today. Today we're going to discuss the background and literature, just briefly, the methods and materials used for this study. We're going to spend most of our time discussing the results and certainly talk about a bit of the discussion or the conclusions to this particular study and where we can go moving forward. The background for this study, as many of you are well aware, we have a crisis on our hands with mental health and suicide around the world, particularly in 2016. The U.S. CDC, or Center for Disease Control, put out a report highlighting suicide and mental health, this crisis in the U.S. And also around the same time, there was one industry organization in the U.S. starting to focus on this matter, and that is CFMA. They began to put out some reports and articles for our industry to be paying attention to with regards to a silent killer in our world, and particularly in the construction industry. In the study, we looked at how other countries are working towards trying to overcome this battle, And in particular, we found in our work that Australia, the United Kingdom, and New Zealand are all looking at and have existing mental health and suicide awareness / prevention programs, and we looked at how those are doing. The gap for this study is really that the U.S. is behind in studying and trying to focus on this crisis. For our methods and materials, we did a survey mostly, but that survey was constructed based off of a thorough literature review of high-risk suicide factors for construction workers and current mental health and suicide prevention programs. In recent years was evaluated and analyzed for the survey development. Then a survey was employed to collect data from construction industry professionals. And we were asking them in that survey, the prevalence and effectiveness of mental health and suicide prevention programs within their industry, the construction industry in the United States. And there were a total of 34 questions in the survey instrument. And the survey was distributed to approximately 1,500 contractors or professional organizations in the U.S., labor unions and trade organizations. And it was a Qualtrics survey software platform was used to deploy the survey. We then collected data for a number of months. I think it was around 3, and then the data analysis process occurred. We resulted in having 103 complete respondents, and you see the some general demographic breakdown of the respondents, largely a male population, and it was almost equally spread between the large businesses and small businesses. The small business versus large business definition was in alignment with the United States small and mid-sized business definition. That is an industry standard, and so it classifies a small business as an organization with an annual revenue of less than 50 million. So a large would be anything more than 50 million. And you can also see the survey respondents demographic broken down by their organization affiliation and the role they served in the industry. So we had the smallest group contributing to this study were field employees, that's 6%. Let's talk about the results. So the results showed that on a Likert scale question where it was 1 to 7 and 7 being strongly agree, the question of mental health awareness and what you're seeing here, the study wanted to ask the level of agreement that mental health and suicide are critical problems facing the construction industry. And what we're seeing is it's not surprising that the safety professionals demonstrated the strongest awareness level at 6.2 for mental health and 5.5 for suicide. When we looked at the respondents based off of female versus male demographics, the female respondents showed a stronger agreement that both mental health and suicide are problems in the construction industry. That is not shown on this chart. And one other thing that I wanted to bring up that's not shown on this chart is the top 4 suicide risks were identified by our participants as stigma, alcohol, drug abuse, pain and injury, and job demand. And from previous research, those are leading risks of suicide. And our survey respondents did indicate that they were aware that those are leading risks. So they were aware that we did find that our respondents were very aware of significant risks that lead to suicide in our industry. Survey respondents were asked if their organization offers mental health treatment, including alcohol, drug abuse programs. And what we see is that general contractors, the professional organizations, and labor trade organizations offer these programs often. So those green and red bars are showing that for those 3 categories, those are saying yes, more than 50% of the time. But we did see that, interestingly, the organization classified as subcontractors or specialty contractors, so that would be someone focusing on a specific area in the building process, only offered these programs in less than half of the organizations that were surveyed. Data regarding the mental health and suicide awareness prevention programs offered when we analyzed versus size in revenue, that small business versus large business, revealed that the larger organizations offered more mental health and suicide awareness prevention programs when compared to smaller organizations. The rate of effectiveness was also asked. It's not demonstrated on this slide, but it averaged about 2.3 among all respondents out of 4. And subcontractors or specialty contractors reported the lowest effectiveness, 1.8 out of 4 for those programs. Field employees rated the effectiveness of their organization's suicide and programs and mental health programs lower than any other role. The last point I want to make in the results is that we did ask about how is this stuff getting to them, and mostly it was through job site materials or toolbox talks, and job site materials such as posters or things that were posted on the job site. And what we found is over 50% of the organizations used those methods. Interestingly, less than 1 in 5 organizations used mandatory training for their field employees as a method to increase awareness. So the conclusions of this is both male and female respondents did correctly indicate that construction is ranked 2nd of all industries with respect to suicide rate. But when we started to ask about the programs that are employed at their organizations, sometimes it depended on which category they were for whether they were actually effective or not. The survey respondents demonstrated awareness for what are the most leading risks, such as stigma, alcohol, drug abuse, pain and injury, and job demand. And field employees showed the lowest awareness of mental health issues and suicide in our industry. And overwhelmingly, job site posters and materials and toolbox talks or safety talks are the preferred method of raising awareness right now. But we probably need to be increasing that mandatory training so that we can increase the awareness and serve as a positive intervention tool to combat the prevalence of suicide and mental illness in the construction industry. And it was a pleasure to present to you, and I'm looking forward to interacting with those who'd like to ask questions.
Lauren, thank you very much indeed for that. A hugely significant piece of work, and my congratulations to you for doing that. It's phenomenal, really, isn't it? Previously, we had our colleagues over in Ireland talking about COVID, and the response to that pandemic and COVID has been extremely high, extremely significant. And yet, I don't know whether anyone's made any comparisons between, the impact of that and the impact, and compare that with the impact of mental health and suicide. And yet we don't seem to be making any progress at all in terms of mental health. Personally, I think the most significant result that you had in that survey is the fact that you got only 6 or 7% of respondents. Only 6 or 7 felt it was even worth responding to your survey. And that is extremely significant in my view, and clearly demonstrates the scale of the situation and the scale of the problem that we've got if we're going to make any difference here. So well done on that. We kind of gone over time. Apologies for my poor chairing earlier on, but I want to give attention to Laura and her colleagues' paper. So do we have any questions? Paul, do you have anything you want to mention?
Yeah, maybe I want to tie together also Jim's talk about hand washing, because it seems like in that conversation, it's put onto the workers, and I really like this Lauren's talk about these prevention programs, which also gives an indication that the employers have a responsibility as well. I'm just wondering, what are their thoughts about the organization of construction work itself? Does it actually make it more conducive for mental health problems and suicide? I'm thinking that construction work is inherently on the move, away from family sometimes, and that could exacerbate. And I just wondered, whether these programs are just like sticking plaster and not actually tackling the symptoms, or tackling the symptoms but not tackling the root cause necessarily of the problem.
Yes. Are y'all able to hear me? This is Lauren.
We can hear you, Lauren. Yes, thank you.
Okay, fantastic. Thanks again. And I agree, Paul, with your comments about the underlying, the leading causes are really not something that's occurring typically on the job site itself. It's more of the lifestyle or the demands overall on the individual, and so those considerations need to be brought to light and talked about openly and honestly, and provided space for figuring out solutions to those things. And all of those ideas would be things the employer does need to have a big engagement, large engagement on, because if they don't, then the people will not. This is something where people will not talk about it unless they're encouraged to do so. They will feel that it is their problem and not something that can be dealt with others. So yeah, I think that's a big thing. And yes, the hand washing is a perfect example of that. Like just putting the station out there and saying, "Oh, it's over there in that corner. Deal with it yourself." It's the same as this. It's not saying a poster is not going to help someone feel like they have an opportunity to speak on what is going on with themselves. And so, we need more. We need more active intervention, more training, and those sorts of things, especially in the U.S. I mean, that's what our study was focusing on, but I would think around the world.
Yeah. Thank you, Lauren. I can see that Mark has raised his hand, and have you got a question or something you want to say, Mark? Please go ahead.
I'd just like to ask, within the American safety systems, is suicide actually reportable, like recognised as a cause of death?
Great question. Yeah, it is. It is. I mean, generally speaking, yes, it is. But within the construction industry, it's not a current reportable incident within the health and safety and well-being protocols that are required of the contractors. So that's another area where we're not even having. We don't have the measurement tool even in place to figure out how significant this problem is within the construction industry specifically, unless it's something that's reported through the family that is associated with that individual.
So I suppose that leads on to my second question, I suppose. Is there any form of legal court recompense the families can get should the workplace be responsible inadvertently for the suicide?
No, not in the U.S. at this time. No.
There's no legal precedent around that at all.
No, not that I'm aware of. I should also preface that.
It's very similar in the UK. That's why I was asking. Because it's not reported over here. Neither is there any legal precedent of any value. To be fair, sadly.
Yeah.
Exactly. Yeah.
Yeah. It's not seen as a direct consequence of a workplace situation. Unfortunately, is it? And
no. This
is possibly one area for the future, but thank you, Mark. I'm very conscious of time. John, do you want to ask a very quick question? John Spillane, are you there? I saw you raised your hand and no.
Simon, thank you very much.
Yeah.
This is Lauren. I'll say thank you, and if someone can jump on, I'll stick around, but also don't feel obligated.
No. I think I was just wondering whether there are some more questions. We struggled for time. These have been 3 fabulous papers, very thought-provoking, very different, yes, but also connections we can see amongst all of them there. And Lauren, I hugely appreciate you coming on. And if you are in the US, then well done for getting up early and joining us.
Yes, I'm drinking lots of coffee.
Drinking lots of coffee. That's the right thing. So I hugely appreciative and really, really welcome and thank you for your contribution, and of course for May in Sweden and Jim and John over there in Ireland. So thank you very much, everyone, for this first session. And apologies for going over slightly. You've got a few minutes now to take a comfort break, get some more of that coffee, Lauren, or go back to bed maybe. And I look forward to seeing you in future sessions. Thank you very much indeed, everyone.